Morning everyone, Kane here. Just thought I'd give you another little update this week, and I thought this week we'd look at a recent study that was published, and this study looks at what is the best pad position for cardioversion. So this study was published in December 2021 in the Journal of Circulation, and the study design was called Anterior Lateral versus Anterior Posterior Electrode Position for Cardioverting Atrial Fibrillation. Okay. And so the study was designed in Denmark, so it was over three large tertiary hospitals, and it was a multi-center open label randomized controlled trial. And it was for elective cardioversions of patients with atrial fibrillation. So in this study, they excluded patients with arrhythmias other than AF, so this was primarily just atrial fibrillation. They excluded patients that had implantable devices, so ICDs or pacemakers. Hemodynamically unstable patients were also excluded, anyone that was pregnant or suspected of being pregnant, and finally anyone that was previously enrolled in this study was also excluded. So this study looked at the two types of pad positions that we can choose to use for doing elective cardioversion. So this was just in atrial arrhythmias, so atrial fibrillation. And so you can see that the top one is your anterior lateral electrode position, like what we use in cardiac arrest. And then the other one position that we sometimes use is the anterior posterior position. So picture B down there. So the pads are on one at the front and one at the back. Both groups received up to a maximum of 4 shocks, and the joules was started at 100 joules, then went up to 150 joules, 200 joules, and the last shock was delivered at 360 joules. And so the primary outcome was looking at first shock success between the two pad group positions, and also the proportions of patients that remained in normal sinus rhythm 1 minute post the shock. So the results from this study showed that there was 468 patients enrolled. They had a mean age of 69 years old. 33% of the patients were female. Their mean body mass index was 29, so slightly on the heavier side. And 55% had a prior episode of atrial fibrillation. So what did the results show of the two pad positions? So the results were quite surprising in that anterior lateral pad position was superior to anterior posterior, so about 21% more superior than going AP using the AL there. So you can see 54% of patients with the anterior lateral position actually went back into normal sinus rhythm after their first shock, compared to 33% of the patients in the AP group. And so this has a number needed to treat of about 1 in 5 with a 95% confidence interval. So quite good results and showing quite superiority for actually using the anterior lateral pad position. Some of the pitfalls from this study is that it was unblinded, so the researchers could see which pad position was being used, so that does lead to these inherent biases in that. This was elective cardioversion, so it wasn't in the actual emergency settings, and so it showed that 20% of these cases were actually just paroxysmal atrial fibrillation, and 80% were actually permanent atrial fibrillation. So that shows that they're more shock resistance with the permanent atrial fibrillation. So a little bit different to some of the cases, but quite similar as well to what we'd see in the emergency department setting. One of the criticisms some of the experts have said of this trial is that they did start with lower joules, and there is some evidence that actually starting with high joules, so around the 200 joule mark for cardioverting atrial arrhythmias, will give you better first pass shock success rate. But they didn't actually look at the joules, they're mainly comparing the actual pad position. So I guess the take-home points, given the anterior lateral pad position is far superior to the AP in this study, it's mostly something we should consider changing our practice. And when you're setting these patients up for cardioversion, have the discussion with the medical staff first. And I think the default should be that we go for anterior lateral pad positions when we're actually cardioverting atrial fibrillation patients. I'll link the full study down below in Microsoft Teams. Feel free to have a read of it and let me know if you've got any questions or want to discuss this further. Thanks, everyone.